Hi, everybody, and welcome to this COVID-19 vaccine town hall for veterans. In just a minute here, we're going to go through some introductions for the panelists here. I'll start out with, my name is Mark Harper. I am the president of We Are the Mighty. We're a media brand for the military community. I'm an Air Force veteran who served 2 deployments in OIF and OEF. And I got vaccinated the day that the West Los Angeles VA started opening up the ability for veterans to get vaccinated. I did it for 2 reasons. One was I had a personal experience with many family members and colleagues and coworkers who got really sick, and it was something I absolutely wanted to avoid. But even more importantly, I got vaccinated as an extension of service and my way to continue serving, helping to protect others. I wore a mask to protect others, myself and others. Got vaccinated to help protect others. And today we're going to go through questions from our audience. Please feel free to drop in comments for the stream here. And we're going to go through some of our panelists here who have some great expertise about the vaccination process, et cetera. So starting with Dr. David Calloway, would you please introduce yourself and share with us why you got vaccinated?
Hey, Mark, thanks for the time. Do we have good comms?
We're good.
Great. Hey, I appreciate the time. My name is Dave Calloway. I am an ER doctor in Charlotte, North Carolina, and I work at a level 1 trauma center, and I am the chief medical officer for Team Rubicon. And, you know, the reason I got vaccinated are pretty diverse. So first, my job is to care for critically ill people in the ER, and I can't do that if I'm sick. My job is to be a father to my 2 daughters, and I can't do that if I'm in the hospital or on a ventilator. My job is to be a leader, and I have to lead by example, and that's why I was the 72nd person in North Carolina to get the Pfizer vaccine. I have to put my money where my mouth is. And, you know, finally, I wanted to be able to hug my mom. I mean, my mom's 77, high risk. She's in that category with my family, and how my daughters get to be with their grandmother and be able to be close to her. And
Yeah, thank you for sharing that with us. Dr. Jane Kim, would you please introduce yourself and tell us why you chose to get vaccinated?
Sure. My name is Jane Kim. I work for the Department of Veterans Affairs. I'm the chief consultant for preventive medicine, and I'm also a general internist and see patients at the Durham VA Medical Center in Durham, North Carolina. So my job for the past 6 months has to plan for COVID vaccination in the Veterans Affairs healthcare system. So I was thrilled when Mark said he got his vaccine, the West LA VA. I was part of the team that planned that whole effort for the whole nationwide network of VA medical centers. And the reason I got vaccinated is, despite knowing all of the science and how to get the vaccines in freezers and into arms, I got vaccinated for my in-laws. Like Dr. Calloway said, I have in-laws who live 5 minutes from me, and they're elderly. And I said, I won't see you until we're all vaccinated. I could not stand the thought of them getting sick from COVID-19, potentially because of me, because I might have it and not know it and spread it to them. And so I got vaccinated for them because my priority is that my family is safe. They're the most vulnerable in our family. And so I encouraged them to get vaccinated, and I got vaccinated too. And like Dr. Calloway said, this spring we were able to hug each other. They were able to hug my kids. And that was priceless. So that's the reason for me to get vaccinated, was truly personal.
That's great. That's great. And Joshua Jabin, would you please introduce yourself and tell us why you chose to get vaccinated?
Yeah, thanks, Mark. Josh Jabin, I'm the Chief Operating Officer for Travis Manion Foundation. I'm a 20-year veteran of the Marine Corps. I actually officially retire on June 1st. And I'm the father of 3 young girls under the age of 10. Last March 2020, my wife and I found out that we were expecting our 3rd child, Liberty. And so the entire time during COVID, we had to learn how to keep everybody safe. So when it finally came time that the vaccines were available, my wife and I were the first in line when we were eligible. Went down to the VA, had a great experience. So my reason for getting vaccinated is to take care of my children, to take care of my family, serve others. And as it turns out, my 9-year-old daughter currently has COVID. She contracted it last week from school. So my reason is to make sure that the kids can get back to school and make sure that we can get back to living life like we were before.
Right. I think we're all ready for that. We've got a question for Dr. Kim. What is the risk difference between a 30-year-old with risk factors and a 70-year-old with no risk factors if both are vaccinated?
That is a great question. I will answer that question on the basis of them being not vaccinated, because it will then show the power of being vaccinated. So we looked actually alongside CDC, we looked at veteran data actually to see what the impact was of COVID on people at different ages and also with different sets of medical conditions such as diabetes, high blood pressure, et cetera. And what we found is that age is the biggest risk factor for getting in the hospital and or dying from COVID-19 for our veterans. By far, it's kind of like a 5 times the risk of having diabetes, heart disease, lung disease, et cetera. If you're older, there's a pretty big chance that you could get severely ill and die from COVID-19. So the impact of COVID vaccination, I would say for a 30-year-old versus a 70-year-old, even if the 30-year-old had a bunch of medical conditions, they're probably not as likely to get sick and die as someone who's 70 and had really no medical conditions. So I'd say the impact of getting a COVID vaccine is probably greatest for those who had the highest risk in the first place, who's the older individual. That being said, the vaccine is great for any age. It provides protection for the young and the old. And we know that young people do get sick, some very sick and die from COVID-19. So although the risk of getting sick and dying from COVID is higher in the older person, like I said, we all need that protection regardless of our age and medical condition.
Right, thank you. Dr. Calloway, why is this moment so important right now?
Yeah, thanks, Mark. So important on a lot of levels, but I think we're having this conversation right now because the question is around veterans and the role that veterans can play in sort of addressing this issue. I mean, I think there's several core reasons why veterans should get vaccinated and can be leaders here. Comes down to trust. We are being called again, and we know this is a complex issue, but we have a very, very diverse community. We're the last melting pot in the United States. All socioeconomic, racial, gender groups are, political persuasions, urban, rural. It's all represented in our community. And so what this gives us is empathy, right? So we all have this common life experience of serving, but we also been through the experience where we've been ordered to do something that we don't want to do or we think is a bad idea. And this empathy allows us to have conversations with people who are rightfully, curious or concerned or want to know more about the vaccine and haven't yet got it. We can
I think we're having some slight technical difficulties with Dr. Calloway. I'm going to move on to another question. Josh, you are featured the Travis Manion Foundation here. Why did the Travis Manion Foundation choose to get involved?
Because it's important. Because we want to make sure that we're empowering veterans to go out there and serve and lead in their community, just like the other partner organizations of this coalition do, especially with Team Rubicon. Thank you for leading the way. Our job is to make sure that veterans have the opportunity to serve and to lead, and the opportunity to set the right example. No class is as well respected as veterans, and for us to show that example, like you said, Mark, we live our entire life to serve others. That's why we joined the military. And getting vaccinated is the same type of selfless act. You know, whether I think that I'm at high risk or whether I'm at low risk, if I get the vaccine, that reduces the risk to everybody around me. And so it's a selfless reason. So Travis Manning Foundation, we want to make sure that we're setting the example and that we're helping to reduce the risk to other people.
Yeah, that's great. All right, we have a question for Dr. Kim. Question is, my child and I have COVID and are living in the same room. Is there a problem with this?
Well, if you both are sure you have COVID, like you've had a positive test come back and the doctor's told you have it, it just is what it is. It's not like you're going to infect one another with COVID if you both have it. I just wish you well and hope that you all stay safe and recover soon. I will just make a couple points though that may be important as you are both sick right now. Is certainly if you're both sick, please follow your doctor's instructions about staying away from others if you're still infectious. Even though you both are sick and can't necessarily give it to one another, you can certainly pass it on to others if you go to work, if you see family, if you go to daycare, et cetera. So please do stay at home until you're told that it's safe to go out again. And the other point I wanted to make is that people who've had COVID, even diagnosed and been in quarantine and such, or isolation, they can still get vaccinated after they get over being sick. A lot of people are like, well, I've had COVID, so I don't need the vaccine. That is true, but you can get COVID again if you've had COVID once. We know that it's rare, but it does happen. And it's looking like COVID vaccines will give us longer immunity, so longer protection against COVID-19 compared to getting COVID naturally for some people. So I just encourage you after you've gotten over being sick to really think about getting vaccinated if that's something you'd like to do to protect yourself. If your child is above is 12 or older, they could get vaccinated too.
I have a follow-up question for you. Question is, I got sick for my second Pfizer dose. Is that normal? I have fever, chills, lasted about a week.
Well, the week part is a little long, but having fever and chills and feeling bad is actually quite common after a COVID vaccine. You hate to say that, but it's just true. There were a good number of people in all the studies for the Pfizer, the Moderna, and Janssen vaccines who had these types of side effects. So we just knew that. But I hope you recovered. Hopefully, if it was a week long, that was it, and you didn't have any other symptoms after that. But we know that a good number of people, more than half, got some kind of side effect like what you're experiencing. But again, the thing to remember is it might keep you out of work, unfortunately, out of doing your daily duties. But a lot of people were able to carry on. Their side effects were mild. And I tell my veterans, hey, I think I'd rather have a side effect that's from the vaccine, but I didn't get COVID compared to getting COVID. Because what I've heard about getting COVID, some people have a mild case, but some people it is terrible. And so I don't know. Everyone's different, but I personally would rather feel somewhat ill and know I don't have COVID, but I'm just getting the immune system revved up against it compared to getting COVID and really not knowing how sick I'm going to get. Severely ill, maybe the long haul COVID. So anyway, I hope you're better. And but yes, side effects like this are common.
Right, and it's a gamble, but I can share with you that when I got my shot at the West LA VA, it felt like a new lease on life. It really was very liberating and exciting after so many months in lockdown. Could you go into a little bit about what the role is that the VA is playing in vaccinations?
Yeah, the VA healthcare system prepared a lot in the fall to make sure that all the veterans that we serve could get a COVID vaccine as soon as one got authorized by the FDA. So as you know, in December, 2 COVID vaccines were authorized by FDA, the Pfizer and Moderna ones. And as soon as we got the shots, we put them in arms. Our first veteran who was vaccinated was a World War II female veteran in her 90s up in New England. And so that was just an incredibly proud moment for us. I cried because just to have a woman veteran from that era is rare. But to be able to offer her protection was priceless. So I will always remember that. So I would say that was the way we started off, and we continued rolling. with every dose of vaccine we got in December, January, February, we offered them to our highest risk veterans first, so our oldest veterans, our healthcare personnel, obviously, so we could continue to care for our veterans, and then kept on going. So to date, we've offered and put shots in arms of more than 2.6 million veterans, more than 300,000 staff, and others as well who work for other federal agencies such as the Department of Homeland Security, as well as we got an act passed by Congress and actually signed by the president to be able to vaccinate veterans who don't see us for care, but who wanted a COVID vaccine from VA, as well as veteran spouses and caregivers. So we've done almost 68,000, I think a little bit more than that, of those individuals. So we've done a lot, but we want to do more. So if there's anyone out there who's, I'm not sure if I want to get a COVID vaccine or not, your VA probably has it, so come on in.
All right. And on that note, Josh, can you speak to the importance of veterans getting vaccinated and being leaders in this space?
Absolutely. And I want to say to Dr. Kim, I got my vaccination through the VA, and it was a very smooth process. So my hat's off to the VA and the preparation they had. Like I was saying before, I think as veterans, people look up to us. I know with my family, my friends, they often come to me and ask questions about a range of topics. And when I show that I'm not afraid to get vaccinated, when I show that I think it's my civic duty to get vaccinated in order to help others, I think we set the example, and I think that, like all things, people will follow us. So if we're willing to step up, then other people will be willing to step up also. And there's really no reason at this point. There's no obstacle that we can't get through. I think it's throughout, since the vaccines have become available, there have been different challenges. I know with my parents, they had a hard time initially getting on lists or finding the right lists, and some of the technology issues, which we were able to work through. I was able to help them with the technology side at Travis Manion Foundation and some of our other partners. I know we've been helping some veterans who had difficulty navigating. But right now, you can get out there and get a vaccine almost anywhere. Some people had trouble with transportation, especially some veterans who needed help getting there. Organizations like ours and others, we can help get you there. So there's no obstacle that we can't overcome. See your local, whatever veteran serving organization you're connected with, and I promise you, we'll help overcome any obstacle you have.
That's great. Dr. Calloway, question for you. Any idea why the vaccine relieves long COVID symptoms for some and not for others? So smell, taste, brain fog?
I actually don't know why it relieves it for some and not for others.
I think it's one of those things where we still don't have as much information as we need.
No, I think we're still, the thing about COVID is we're still learning a lot. And Dr. Kim made a great point about understanding why it affects some people very seriously and why it doesn't impact others. What we know is that the vaccine is almost 100% effective at preventing death and severe COVID illness. It's truly remarkable. The Pfizer and Moderna vaccine both. This is truly, if you want to think about it, this is American exceptionalism, right? The government funded the private sector to move fast and develop a vaccine. They kept the regulations in place that were important. They helped streamline the other processes, and we've got a vaccine that it literally is more than 95% effective at saving people's lives. It's amazing.
Could you maybe walk us through herd immunity?
Yeah, so herd immunity or community immunity is basically when a large enough percent of the population is protected from a virus, either through vaccination or prior infection. And the way you can think about it is the fewer people there are to get infected and spread the disease, the safer community will be. And there are all kinds of metaphors about, umbrellas and rain jackets and forest fires. But the basic is the more people that are vaccinated, the more you can protect those who can't get it. So the kids, Josh was talking about his kids that are under 12. They are protected if we have herd immunity. The immunocompromised, so your grandma with cancer who's on chemotherapy, they are protected more if we have herd immunity. And so that's the service aspect of this that Josh was also talking about, which is why it's important for so many of us to get vaccinated, so we can protect the vulnerable and protect those who can't get the vaccine themselves.
Dr. Calloway just went through, how the vaccine came to be. We have a question out there about, these COVID-19 vaccines were developed so quickly. Dr. Kim, could you help us understand why we know that they're safe?
So the technology that went into the first two COVID vaccines that came out have been actually in the works and in development for about 20 years. So the fact that they came up last year was not without a lot of development beforehand. And then the third vaccine, the Johnson & Johnson one, that already has a proven vaccine technology in it, and it's just a version against COVID-19. But I will say that people do wonder about this. If even with these known technologies, it seems like these were sped through in less than a year. How can we trust the process? And I get that because most vaccines take multiple years to get through. The way that people have described it, which I like, is the companies that make these vaccines typically go one step at a time, and they don't go on to the next step until they've completed the step before. And the reason they usually do that is they have to make sure the first step works before moving on to the second in order to invest more time, energy, and money into the process. If something's not going to work out, they don't put energy into it. They go to something else. The way that it worked with the COVID vaccines, however, is that the US government funded all of the steps at once, so money was not an issue. They could go to step 1, 2, and 3 all at the same time, run them all on a track, parallel tracks, and come out with an answer sooner. And so because the US government removed the barriers to kind of going one step at a time and let all steps run at once, we are able to see the results much quicker than we usually do. And alongside that, the FDA, Food and Drug Administration, always has a very rigorous review and safety process as well. They made sure they were involved from the beginning and looking at the data, making sure everything lined up with safety. And so I will just say there was oversight from many levels of that process to make sure everything was safe, that the vaccines worked, that if they were released to the public, they were as safe as we knew from the science. And indeed they were. And they've proven to be. They've been out for almost 6 months now. So a good news story, phenomenal work from this country to support vaccines being developed so fast.
And you just touched on the fact that there are, 3 different vaccines out there currently available, and questions that I've seen people debate in life here is, how do we know which one to get? And what would be your response to that question?
So I was thinking about that, and I will say you're very right that all the COVID vaccines are safe. They work to protect us especially against getting severely sick in the hospital and dying from COVID. And so they all work really well, and they're all safe. I will say, though, the difference is to me kind of looking at it from your perspective, if you're not vaccinated, is that 2 of them are 2 shots. And so some people don't like needles. And so if you don't like needles, you probably want to get the 1-shot vaccine, which is Johnson & Johnson. Another difference is the technology. So the 2-shot ones are this mRNA technology, which is newer, but has been really shown to be safe and to work well for protection. The other one is a different technology, the Johnson & Johnson, and it's the 1-shot. I will say for the Johnson & Johnson vaccine, the cases where someone might want to consider not getting it or just thinking twice about it is younger women, so women who are 50 and younger, because there is a very rare but very severe blood clotting syndrome that happens to a very, very, very small percentage of women who've gotten this vaccine. But if that's something that worries a woman, they can choose to get the Pfizer or Moderna vaccines. And the other case, which is also exceptionally rare, is if someone has recently been very sick with a certain kind of, I even hate to say it, it's a blood clotting disorder that also has low blood platelet, which is blood clotting cell counts. Pretty much, if you've been very sick in the hospital with something that made you very ill and it has to do with blood clotting, ask your doctor first, because those people should really not get the Johnson & Johnson. They should get one of the other vaccines. But other than that, there are a lot of choices, and it's really about convenience where you can get it, and if you prefer 2 shots versus 1 shot.
Sure. Okay. Dr. Calloway, can you explain a response to those who profess that getting the vaccine now means they are immune from COVID?
Well, I mean, what we know is that if you complete your series, so if you have your one J&J Johnson Johnson or your two Pfizer Modernas, then you for a period of time you have developed immunity to the COVID virus. Now, nothing is 100%, and so you probably if you Google it or you look at the CDC, there are 7,000 people or so out of the I don't know 200 million vaccinations where we're at who've gotten COVID after the vaccination. So no immune response is 100%, but the protection is very, very good. And one question that comes up is how long am I protected for? And that's information we're still learning. And it's at least 6 months, maybe 9 months, maybe up to a year. But again, what we know is that if everyone were to get vaccinated right now, so we have enough vaccines to vaccinate all Americans. If everyone were to get vaccinated right now and we achieved herd immunity, in the next month and a half or 2 months, that would create a significant decrease in COVID risk and COVID rates in our country come the fall. And so as we get to herd immunity, that's less virus around, less likely for it to spread, and it makes the community safer. So they are protected. They don't get lifelong immunity. Very few vaccines do that, but they definitely give you immunity for a while.
Speaking of that, there obviously for these double shots, what happens if someone is unable to get their second shot in the amount of time prescribed? Is it okay to wait an extra week? How does that work?
Yeah, so that is also an awesome question. We hear it a lot. So I think a paper came out just this week that said, you're about 84% protected after your first shot of Pfizer or Moderna. We know it's somewhere in that range, so it's not as good as having both shots. And then, in the UK, this idea of spreading out your second shot has been looked at. The fact is, it's probably okay if you're delayed a week or 2 weeks or even a month. They're researching that right now. The current recommendation is not to do that because that wasn't what the process for approving these vaccines. But if you're traveling or you're sick or you miss it or your job won't let you off for the second one, it's okay if you get it at 5 weeks instead of 4 or 7 weeks instead of 4. It's just not ideal.
Gotcha. Josh, for our younger veterans out there, what would you say to people who believe that they are young and healthy and they do not need to get vaccinated? This is the tough one here.
Yeah, I would say, there's a reason why you join the military, and that's to serve other people. And I would think of this the same way. I said before, I have 3 daughters under the age of 12 who don't have the opportunity to get vaccinated. 2 of them are quarantining upstairs right now. My 9-year-old has COVID. She got diagnosed on Saturday, and she has to miss a week of school. Luckily for us, she's not very sick. Could have been a lot worse. My 6-year-old is quarantining in the other bedroom so that she doesn't contract it and go back to school and bring it with her and spread it to others. And my wife and I just pray that our 6-month-old doesn't get it because we have no idea what the outcome would be for a 6-month-old. So to all those young veterans who aren't sure whether or not they are at high risk for bad outcomes, I hope you think of my daughters. I hope you think of all the children who are under the age of 12 that don't have the ability, and just think about how great life will be once we can reduce the count to the point where everybody gets to go back to work, everybody gets to go back to school. We can all go back out and start being with each other, and that will happen someday if we all do our civic duty, if we all get vaccinated.
Hey, Mark, could I add just a couple points?
Yes.
Yeah. So through Team Rubicon and the hospital system where I work, Atrium Health, we have vaccinated over 2 million people across the United States. And in those numbers are my wife, my parents, my godkids, my niece and nephew, my best friends. And there are 2 personal stories that stick out to answer this question because I've had it a lot with a lot of people in Charlotte and in our rural areas like Stanley County and Rutherford. So number one is do it for yourself. So the narrative has been you either get COVID and you die or you don't die. And that's not the deal, right? There's a whole lot of suck in between that. And so Mark is my neighbor's kid. He's a D1 athlete, played tennis and track. He got COVID in the fall and he didn't die. He didn't even get hospitalized. He had an inhaler and steroids that he used for about 3 weeks, but he couldn't breathe. He could not run around the block for 6 months. This is a Division I scholarship athlete who did not get hospitalized, did not die, but could not run around the block for 6 months without stopping to breast. Now that sucks. And he's young and he's going to live. We don't know if he'll have long-term consequences, but that is miserable. And so do it for yourself because you don't want that. The other is do it for your family. And one of my nephews is this cocky 25-year-old kid. He lives in South Florida. He got COVID in the fall also. And basically he had the gall to email me and say, hey, this isn't that bad. I don't even feel that bad. He went and saw his parents and he infected both of them. And his dad ended up in the ICU. Now his dad recovered and is better, but I still talk to him about it right now and he feels guilty because he got it to his dad and his dad almost died from it. And then the final, which is Josh's point, is do it for your community. Do it so that our kids can get back in school. They can get out playing together. They can get to the park. The bars can open up. Our restaurants can open up, and we can start getting back to what's really, important about the social fabric of our community. Just let's do it so we can get back together and come out of this pandemic stronger than we were in 2019.
And let's say that the world goes back to a version of a new normalcy. Dr. Kim, will boosters be required, with all versions, and can they be mixed and matched in the future?
I think the future will tell us whether we need a booster. It depends on a couple things. I'll just name a few. One of them is how long our protection against COVID-19 lasts after we get a vaccine. So we think it still lasts after 6 months, but we're going to watch every month. I'm sure there will be science to tell us how long it lasts. Once the immunity drops off, boosters will probably be a topic of conversation. The other thing that will be watched is the variants, which are different types of COVID, the virus that causes COVID-19 out there. There are a few that are in circulation in the United States that originated in other countries that don't look like they'll be real dangerous for us, but something may crop up every day, a new variant, et cetera. So if there's a new version of COVID that comes around and we don't have protection with the current vaccines, that's another reason to get a booster. I think based on just other vaccines that are out there, mixing and matching is appropriate. Like when we get our flu vaccine each year, I don't know which manufacturer made my one from last year. You just get the one for this year. So probably it'll be something like that. Like if you got the Pfizer vaccine this time around, you don't have to go looking for Pfizer next time around. But if and when we'll need boosters really depends. And I will bring it back to the fact that if we can start to really beat this COVID into the ground now by getting vaccinated, we won't really need to worry too much about that. But the more we let it run through our community and never really go away, the more likely we will be having these conversations sooner rather than later. So I just encourage everyone to, I just don't want to live like this anymore, to go ahead and get your vaccine so we can have a decent fall and winter. I know people want to go skiing, want to see family. Absolutely. And how can we do that? Is vaccination is a cornerstone of that.
Can you share with us what the current vaccination rates are among veterans?
Yeah, I can speak to the veterans that we serve here in Veterans Health. We have given vaccines to about 40% of the veterans we serve here. Now, what we don't know is how many of our veterans have gotten vaccinated through their state, through their local doctor that's not a VA doctor, et cetera. We think the percentage is much higher, but we're just not sure because no one necessarily comes back and runs to us and says, I got a vaccine over at CVS. But we're asking now. We're saying, did you get a vaccine? We really want to know about it. We know from the general U.S. population that I think around 80% of older individuals, I think 65 and older, have gotten vaccinated. So we're pretty sure, because we have a lot of older veterans in our system, that it's a pretty high percentage who've gotten vaccinated with us or through their community. But we're still working on reaching out. If we have people who've gotten a vaccine, we want to know, because that just makes me feel better as a doctor. But if you haven't been, we want to talk to you. And if you had questions about vaccination and weren't sure, we're here for you. We want to talk with you. We want to hear what your questions are and help you understand more and help you make a decision.
That's great. We kind of touched on this a little bit through some other answers, but I'd just like to reiterate this again. Dr. Calloway, as a veteran yourself, could you help us understand why veterans are so integral in getting, the rest of the U.S. vaccinated?
Yeah, it sounds like my last answer got garbled by the tech demon. But I think there are a couple roles that veterans play. And Josh hit on this, but just to reiterate, veterans as a whole are one of the most trusted groups in our country. And this has been built over, generations of service and sacrifice and responding whenever our nation needs us. We are a diverse community, probably the most diverse community in the United States. And we're unified by this common bond of service. And, that trust and diversity also gives us deep empathy, and it allows us to have conversations that are really important about, vaccination. There are legitimate questions about getting vaccinated. I shared a story earlier about we've all been, as veterans, we've all been in that position where we've gotten that order that we think is stupid or that we don't want to do, and we've still followed it. And so we know what that feels like to feel like someone's telling you have to do something. And so I think it allows us to have the conversation around vaccination in a much more respectful, and kind way, and to hear people's concerns and to meet them where they're at, and then to hopefully, over time, help them understand why it's important to get vaccinated. And I think veterans will lead the way. They'll lead the way in the rural areas where we have, lower rates of vaccination. They'll lead the way, uniting the conversation around vaccination. And I hope that this team here continues to do the great work, and Team Rubicon and IAVA and the Veterans Coalition for Vaccination and Travis Manning. I mean, these are important voices that are trusted. So let's have those conversations. We're here to answer the questions.
That's great. Thank you. Dr. Kim, we have a question about, how does everyone feel about the social, emotional, and psychological impacts of the pandemic, and now the potential normalization on healthcare workers in the population?
Yeah, this pandemic has been really hard. I think no one can deny that. And I will start by saying that we in Veterans Health know this very well. We have a lot of veterans who have PTSD, who have anxiety, depression, and we, it's been tough. If you have a mental health diagnosis or if you don't, it's been really tough. And so I think one thing that has stuck out to me, and this is personal as well as professional, is when you hit rock bottom, reach out. I think I did, and I had to reach out for the first time in my life to get help. And I will say there has been a stigma around mental health and saying that I need help because I don't feel good. But I think more than anything, this pandemic has shown us we're all there. And so when you are, reach out for help. We're here for each other. VA is here for you. And so I will say the toll has been significant, and reaching out for help is the first step. But for some of us who've gone through a lot, it's going to take us a while to get out. And I think that's okay. I think sometimes, and soldiers may feel this way, you got to jump back up. You got to keep on going. But it's been a year and a half almost, and it's been tough, really tough for some people. So I'd say if you're in that place where you're needing help, reach out. If you call VA, we're here for you. And, you might have other supports as well. Give someone a call. The human connection really has been lost in many ways throughout this pandemic, and it's just shown us how much we need each other. I think healthcare professionals are worn out and tired. I can't say it enough, and I know that a lot of my colleagues and I need rest. And so I will just say it's okay to admit weakness. I know soldiers are not necessarily supposed to do that, but in this case, admitting weakness is strength. And I just encourage everyone, if you're in a place where you need help, to reach out. And if you're in a position to help someone, I hope you do, because we just have to be honest that it's been a tough year and a half, and we're going to need to lean on each other to get better.
Gotcha. Okay, I'll do this last question around the horn. Josh, what would you say to someone who is on the fence to get vaccinated?
I'd say that you never know when your number is going to get called and someone's going to need your help. I keep thinking about with my family dealing with COVID right now, I keep thinking about how would we as parents be able to take care of our children if we weren't vaccinated? I have to go into my daughter's room who's quarantining and make sure that she's eating, making sure that she's taken care of. And then I have to go take care of my 6-month-old baby right after that. And if I weren't vaccinated, how do I do that? How do I take care of both of my children at the same time? I have elderly neighbors who may need my help. I have family members who need my help. So the best thing that we can do to prepare to help others is to make sure that we're vaccinated ourselves. So I hear Dr. Calloway, there's a lot of reasons why we should do it for ourselves. I don't think I'm going to win any veterans on that argument. You know, if people think that they're indestructible, I don't think we're going to convince you otherwise. But I do think that as veterans, we feel that deep sense of purpose, that deep sense that we're here to serve others. It may be your own family, as I'm dealing with right now. It may be others around you, but if you aren't vaccinated, you're not going to be in the position to help others. So take that first step today.
Dr. Calloway, same question to you. What would you say to someone who's on the fence to get vaccinated?
Yeah, Josh, I really appreciated your comments. I think what I've been trying to do, because now my job is to talk to those people, is to ask, to say, hey, I'm here. Let's have a conversation about it. What can I do to help you understand? What can I do to help you feel more comfortable? How can I meet you where you are? And make sure that you have the best information when you're making these decisions. Because at the end of the day, it is your choice. It's your choice, but I'm sure that you'd like to make sure that you have the best information when making that choice. And, what can I do to help you? Who can I put you in touch with? What questions can I answer? How can I help you with that decision? And that's how I've been trying to approach it recently.
Great. And Dr. Kim, over to you. What would you tell someone who's on the fence about getting vaccinated?
Yeah, I was thinking about that because sometimes I feel like a vaccine evangelist, but probably the people on this call, there are a lot who are not sure. So I think what I would say is what I'd say to one of my patients who told me, I don't know if this is for me. I'd say, well, I respect that. But I will say that I recommend this to my friends. I recommend this to my family, the people I love the most. I would want them to get vaccinated, to protect themselves, to protect others. And I consider you like family. I truly do. So I recommend it for you because I care about you. I care about you wanting to get back to your life. And so that's why I'd recommend a vaccine for you, because you matter to me. So if that helps anybody, if that's what I tell my patients, and they can make their own decision, but the people I care about, I want the best for. And so vaccination falls into one of the best things I can offer and recommend to them as someone I care about.
Great. Well, Josh, Dr. Calloway, Dr. Kim, thank you so much for your time and your expertise and your thoughts. This is a challenging topic in our military community, and it's really great to have resources like you and your organizations to help spread this information. We're going to put a slide up here about resources to take a look at for further information. And thank you to everyone who tuned in to listen to this discussion, and hope you all get vaccinated.